Good afternoon, everyone, and thank you for being here. We're going to give it another moment and let everybody join, and then we'll go ahead and get started. Okay. So thank you and welcome for joining us today for our California Immunization Coalition Education Hour. Today's host and moderator is Meg Dorsey, and I will pass it off to her.
Good afternoon, everyone, and welcome. My name is Meg Dorsey. I'm a CIC board member and the current chairperson for the CIC Education Committee, and I'll be your moderator for today's program. The California Immunization Coalition hosts education hours and emerging issues conversations throughout the year on immunization-related topics to help our colleagues stay up to date on important news and information. And we're very pleased to have you join us today for the program, which will discuss how Women, Infant, Children Program, or WIC, can be an important partner in improving immunization rates. There is a long history of WIC, which is a federal program working with immunization programs at the state and local level to improve both access and services for beneficiaries of both programs. By the end of the webinar today, participants will be able to, 1, describe how WIC monitors immunization status for enrolled children, 2, how immunizations are incorporated into the WIC wellness visit, and 3, identify opportunities for future collaboration with WIC to support immunization efforts. And now for a little bit of housekeeping. Following today's webinar, a recording will be available on the CIC YouTube channel. If you are unfamiliar with the CIC YouTube channel, I encourage you to check it out because you will there find a recording for this program as well as our previous education hours and emerging issues conversation programs. And be sure to subscribe. And as a reminder, we want to thank CDPH. Our speakers today both are with the CDPH program, and we thank them warmly for collaboration for this program. And as a reminder, all participants will be muted throughout the program. Excuse me. If you need technical assistance, please use the chat section and also see the chat box for instructions that can be helpful to troubleshoot any technical issues. We will be holding questions until our speakers have both presented, but please feel free to submit your questions at, excuse me, all of our speakers have had little coughs today, and I guess I'm joining the crew. We will hold questions until after our speakers have presented, but please feel free to submit your questions at any time during the program using the Q&A box at the bottom of your screen. And it's now my pleasure to introduce our two wonderful speakers for today. Allison Siegel, MPS RDN, is the Senior Manager of Nutrition Services and Projects at PHFE WIC, where she oversees staff training, participant nutrition education, the medical formulas process, and other key projects. Previously, she served as a client services manager, working closely with frontline teams to provide services and support to WIC families. She's excited to be here today to join the discussion on WIC on immunization within the WIC program. Catherine, or Kat Yepes, MPH, is an associate data scientist, an early stage investigator at PHFE WIC, with extensive experience analyzing WIC administrative data alongside other sources to study nutrition, infant feeding, and participant experiences. Over the past 9 years, she has coordinated research studies while also contributing to and leading work on grants and publications. In her role, she bridges work between departments within WIC and collaborates with external partners to provide data-driven insights that inform both programs and policies. Allison will be our first speaker today. So Allison, I'd like to turn the mic over to you to begin your presentation. Thank you very much.
Thank you so much, Meg, and good afternoon now, everybody. I am Allison Siegel, and I am here today with my colleague, Catherine Yepes, and we are delighted to be with you to share more about the WIC program and how WIC supports childhood immunizations. We'll also be highlighting our immunization intervention project that we've worked on in the past year, which we'll share with you in the last half of our presentation. So next slide. Okay, so just to give you an idea, we wanted to give you an idea of where Catherine and I are located. We are in Southern California and are part of the Los Angeles County WIC program, specifically the Public Health Foundation Enterprise PHFE WIC program. So, for those of you in the Southern California region or LA County more specifically, this map may look a little bit more familiar to you, but just to give you an idea of the areas that we cover. Next slide. And so here are more of the LA County WIC programs: Antelope Valley Medical Center, Northeast Valley Health Corporation, PHFE, City of Pasadena, City of Long Beach, Lundquist, SLAHP, and Watts. And so some of you who may be in the Southern California region may have worked with your local WIC agency, but there are many of us in the LA County area. And if you're not part of LA County or Southern California, we do have throughout California 84 WIC local agencies. So the WIC program provides services through 84 local agencies, including local health departments, community-based organizations, federally qualified health centers, and university organizations. Each month, California serves over 1 million participants at more than 500 WIC sites throughout the state. 61% of participants are children under age 5. So what is WIC? So some of you may be very familiar with WIC, and some this may be a refresher. But the Special Supplemental Nutrition Program for women, infants, and children was established by the USDA in 1974. And the WIC program provides supplemental foods to pregnant and postpartum women, infants, and children up to age 5 who are low income and at nutritional risk. And here are the many health benefits of the WIC program. Multiple studies conclude that WIC participation impacts a broad range of outcomes, including improved access to healthier foods, healthier birth outcomes, reduced infant mortality, lower rates of childhood obesity, and improved developmental outcomes. So the categories that WIC serves. So WIC serves pregnant women at any point in their pregnancy, postpartum women, including breastfeeding women and non-breastfeeding women, and those with pregnancy or infant loss, infants under the age of 1, children under the age of 5. And WIC also serves foster families with infants or children under the age of 5. And WIC is not only just for women. Grandparents and dads with children under 5 are also welcome at WIC. And this is all based on if they meet eligibility guidelines or income guidelines. So WIC offers or follows a hybrid model. We offer, when offering services, it's both in-person and remote. So we offer in-person services, phone services, and group and individual counseling via Zoom, which has offered, a lot of flexibility and improved access to WIC services for participants, particularly after the shift prompted by the pandemic. So these are the 4 core WIC services that are provided by the program. First, we have nutrition education. WIC provides family-focused nutrition education to guide through all stages of the family's life. So that's from pregnancy to first foods for the baby, finger foods for your toddler, healthy meal ideas for the whole family, all of that. And we do offer one-on-one counseling with WIC counselors. A lot of our WIC staff we have specific nutrition and health questions that we ask our participants on the program. We offer also online education. So they are able to take WIC classes online through our online education system called wicchealth.org. And some local agencies also offer Zoom group classes as well. And then with breastfeeding promotion, and with breastfeeding promotion, WIC promotes breastfeeding as the healthiest way to feed babies and help parents meet their breastfeeding goals. And so WIC offers lactation support through counseling, education, peer support, and access to breastfeeding, like pumps in order to help families start and continue breastfeeding. And we offer food benefits. WIC offers food benefits every monthly benefits that offer specific healthy foods like fruits, vegetables, whole grains, milk, etc., that all support growth and development. And lastly, WIC also connects participants with additional programs, healthcare and social services. And if you go to the next slide, we'll share more information about that. So, there are the WIC is a nutrition breastfeeding program, and participants may have non-nutrition related needs as well. So making referrals is how WIC helps participants with any concerns or anything that comes up where they need support. So we do offer referrals and resources. Some examples there, obviously, immunization, there's Medi-Cal, CalFresh, CalWorks, housing, dental health, all that's listed there as well. So, how can you help connect families with WIC? Well, WIC helps your patients with information and support for having a healthy pregnancy. WIC offers education and support for exclusive breastfeeding for the first year of life and beyond, as well as personalized nutrition education services, improving access to healthier foods, helping with ideas for preparing healthy meals and snacks for their children, and referring to healthcare providers for high-risk factors. For example, sometimes we could have, a pregnant participant who may have a history of gestational diabetes or high blood pressure. So we make sure that we refer them to see their healthcare providers to ensure that they're getting the proper care and medical advice. So here are some ways that you can help refer to WIC. You can refer patients to WIC by providing their height, weight, recent hemoglobin or hematocrit. We do look at, we do screen for iron deficiency anemia by looking at hemoglobin. And also if you have any participants who are pregnant and could be eligible for WIC, we do ask for estimated due date as well. So you can help refer patients that way. You could also share the WIC website to find the latest income guidelines and other information. And we hope to give you this information so that you'll see all the links thereafter. And you could also share our website for WIC families, which is myfamily.wic.ca.gov. That website has great information, not only for WIC families, but for families who are interested in WIC. It does have information of how, to see if they're eligible and how to apply for WIC as well. And they also have just other good resources on there, like, information on how WIC helps. Am I eligible? They have nutrition resources, information about immunizations, all of that as well. And you can also ask patients to call a toll-free number 888-WIC-WORKS, available in 5 languages. And I added there's a specific healthcare provider page, which I think is helpful if you are a healthcare provider attending today. But it does have good information about WIC updates, how to know if a WIC participant is eligible. And particularly if you have participants requesting like special, what we call therapeutic formulas or medical formulas, that page also has information with how that process works as well. Okay, so now to kind of the meat of our presentation. So WIC's mission is to be a full partner in ensuring healthy and well-nourished women, infants, and children. Low-income children are less likely to be immunized than their counterparts, placing them at a high risk for potentially serious diseases. So educating WIC participants and their families about the importance of immunizations and providing referrals to immunization services is a part of WIC efforts. And so this is just our standard protocol for screening and referrals of immunizations. So parents are informed at appointment scheduling that immunization records are requested, but they're not required in order to get your WIC benefits, but we do request them. So for children under 2, WIC must screen their immunization history. So we check for the way that we do that is we check for DTaP doses by the age milestones. And so if a participant comes in with their, and they bring in their immunization record, we look to see if there's 1 dose by 3 months, 2 doses by 5 months, 3 doses by 7 months, and 4 doses by 19 months. And then if a participant is under-immunized or records are missing, WIC staff will then provide immunization schedule for the caregiver and offer referrals to low-cost community clinics in their county, and then just continue to encourage parents to bring records for future visits. Okay, so now we want to share with you more about our immunization intervention project pilot that we worked on in the last year. So CDPH and PHFE WIC collaborated together to study the effectiveness of a text-based immunization intervention for children enrolled in the WIC program with the goal of improving vaccination rates among those receiving the intervention. So in developing this intervention, careful consideration was given to minimizing the workload burden on WIC staff, as this could affect the sustainability and scalability of the pilot. So as a result, the intervention was designed to rely on automated text message reminders. So 10 PHFE WIC sites were identified and selected as intervention and control. And so participants at 5 PHFE WIC intervention sites received age-specific text message reminders aligned with their child's upcoming well child visit. And so we utilized our existing text messaging platform in order to deliver these messages, and the intervention was implemented from August 2024 through June 2025. Okay, so text messages were scheduled based on each child's date of birth and were delivered about 2 to 3 weeks before each child reached the specific age milestones. So you see this age milestones are 1 month, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 2 years, 2.5 years, 3 years, 4 years, and 5 years. And these milestones are based on the American Academy of Pediatrics recommended schedule for well child visits. And the text message included a link to a PHFE WIC webpage containing well visit information with the immunization content at the top of the landing page. And the page also provided additional well child visit resources, including guidance on developmental screenings and nutrition. So PHFE WIC collaborated with the CDPH immunization branch to co-develop the messaging and linked resources for the immunization info on the webpage. So the immunization info on the webpage included an age-specific recommended immunization schedule from CDPH, frequently asked questions along with answers, and vaccines for children program info, along with a clinic locator tool where they could pop in their zip code and find a VFC clinic. And we also included quick videos on certain vaccine topics that were from healthychildren.org. And also information, a link on how to retrieve their digital vaccine record, particularly those who need it for, childcare records or school records. Okay, so this in a nutshell is our monthly text message engagement summary for the project. So in total, we had 24,755 participants from the intervention sites that were contacted via text. And there was a total of 96,898 text message sent throughout the intervention period. To the top, if you see the top right, we have a sample message of what a 4-month well visit text looked like. It says, WIC, time to visit the doctor for baby's 4-month checkup. We know the health and well-being of your baby is important to you. Here is what to expect. And it has a link to that web page. And we gave an opportunity for participants to unsubscribe from these type of reminders. And so in total, we had 109 opt-outs, those who replied with an X. That was actually a concern of ours because we were afraid because, they also get additional WIC focused messaging as well. So that was actually good to see. Now to the table with all the numbers in there. And apologies if it's really tiny, but it shows you the month in the first column starting from September 2024 all the way down to June 2025. And for each month, it shows how many texts were sent in that month, which varied from month to month, depending on, the child's birth date. And it also includes how many opt-outs there were for that month, the link clicks per month, as well as the click-through rate, which is the percentage of participants visiting a web page by accessing that hypertext link in the text message. And so I wanted to point out that in January and March, it's listed twice because in addition to the well child visit reminder text, we also sent targeted supplemental messages to promote the seasonal and outbreak-related immunization. So in January, for example, flu and pertussis text messages were sent to all in the intervention group, which was over 18,000 of them. Again, some of them aged out. And so that's why you see that number there. And it linked an information about influenza and whooping cough prevention. And then in March, we sent in March to age 6 months to 15 months, we sent measles, mumps, and rubella messages in response to the measles outbreaks in Texas and New Mexico. So overall, the click-through rate included only, which includes only the well child text, that was 18%. And I also included the click-through rate, which is the well child, which includes the flu and pertussis text, and that was 14.2%. I didn't include the MMR just because we didn't have access to the MMR info since that was an external web page. I don't know, I think we have time. If you click on the sample message, or I don't know if you have the page, Cameron, on there, of the sample web page. So this is a sample. I mean, this is the desktop version, but I wanted to share a visual for people who like, seeing it. Is if you could scroll down, it does show kind of what is on the page for the link that was provided in the text message. So you'll kind of see on the top, it does have info on the immunizations with what we had shared with you that was listed in there. Okay. All right. So in addition to the well visit text and the flu MMR text, we also sent follow-up surveys in March of 2025. So survey text messages were sent to over 4,000 caregivers of children at the intervention sites in these 5 key age brackets, 6 months, 12 months, 15 months, 18 months, and 24 months. And so these same survey messages were resent in April and May and June of 2025 to participants who had not responded previously. So they served as basically extra reminders. So each survey asked caregivers whether they had taken their child for their corresponding well child visit. And participants were instructed to respond by texting a number that corresponded to one of 3 response options. And based on their reply, participants received automated follow-up messages. So you'll see in the table there, they replied with 7. That meant their immunizations are up to date. And then they received an automated message. That's great. If you have your baby's recent height, weight, and immunization records, you can upload them using this link. And if they replied 8, yes, but we didn't get any shots, they received the automated message. Thanks for your reply. Learn more about how immunizations keep your baby healthy and protected. And we sent information link there. And lastly, if they replied 9, I haven't taken my baby yet, there's still time. Contact your doctor to get your baby up to date on immunizations or get free vaccines through the Vaccines for Children program. We also conducted phone interviews. So caregivers who received these survey messages in April and May were randomly selected for phone interviews. So participants were grouped based on their survey responses, whether they were in the group of 7, 8, or 9. And in total, we had 19 participants, 9 English-speaking and 10 Spanish-speaking participants who participated in the phone interviews. And these interviews aimed just to gather qualitative feedback on message effectiveness, caregiver decision-making, and perceived barriers to vaccination. And these are basically the key takeaways from the phone interviews. Reminders were helpful in prompting them to schedule and attend their child's doctor appointments. Most participants were already motivated to complete the well child visits to receive immunizations, but the text served as timely nudges. One caregiver specifically noted that the reminders helped them avoid procrastination. The frequency and timing of the text messages were generally described as just right. And families overall expressed a desire to continue receiving them even after this pilot. And these were reported barriers to vaccination, which included some logistical challenges like inactive Medi-Cal coverage. Sometimes in response, we would get a response saying that, oh, I'm switching my Medi-Cal coverage, or we don't have a doctor yet. So that's when we would share information about the VFC program. Some of the parents said lack of transportation was an issue to go to the doctor, and inability to print WIC referrals. That was interesting as because I think there was this assumption they needed to bring in a paper form to bring to the doctor in order to get like the information that we're requesting. But that's when we shared, that the mobile versions of these referrals. And then there were health-related concerns like my child being ill during the visit or fear of receiving too many vaccines at once, and concerns about specific vaccines, such as the belief that the COVID-19 vaccine is too strong. Okay, so sorry. So now I'm going to pass it on to Catherine. Catherine did a lot of our data analysis, receiving the data, analyzing it. And so she's going to share with you more about the up-to-date rates.
Thanks, Allison. So again, I'm Kat Yepes. I'm going to be going over specifically just the immunization rates by child age in months. And we're going to focus on the total up-to-date immunization rates by child age, because we do have information about each one of the individual vaccines, but it was a little bit too much information to throw out all at once. So we're going to keep it to just the total to date. For these rates, it doesn't include RSV, COVID, or flu, but we are looking at the 4 different time points where we received data. In the chart, you'll see in blue, we have August, in green, we have November, yellow, we have March, and June, we have red. So these were the 4 time points where we collected data for immunization rates. And across the bottom of the chart is all of the age ranges where we looked at these immunization rates for children in the sample. This is the general sample. This isn't looking at the groups just yet. And you can see for the 3-month group, we only have the first 2 time points because they were aging out as the study progressed from this age group. So this is one group that we're following, and we're not adding new children into the sample. You can see that the highest rates are among the 3 and 5 monthers, and then it drops off after 7 months. So there's lots of room for improvement. I want to draw your attention to the very last set of columns where it says all children. This is the average immunization rate for total up-to-date for all of the children in these age groups. So all of these combined, we have about 24% on average total up-to-date immunization rates for this group. Next slide, please. So now this one's a little bit more busy, but I'm going to walk you through it. We're still looking at the total up-to-date. Again, this doesn't include RSV, COVID, and flu in the immunization rates, and we're going to be looking at the child age in months, and now we're dividing it up into the two groups. So the two different colors here, in blue, we have the intervention group, and in yellow, we have the control group. So you'll see that we have two sets of charts basically in the same page. We're looking at the bars first, which is the same immunization rates that you had seen in the previous slide, but now we're dividing it up by the intervention in blue and the control in yellow. So you can see in some instances, it looks like the control groups have slightly higher immunization rates, but we really wanted to see was the impact that these new text messages had on increasing or not the immunization rates in the intervention group. So that's where the dashed lines come in. In blue, again, we have intervention, yellow control, and the dashed lines are basically looking at the net change in immunization rates from time 1 to time 4 for each group. So basically what we did is take time 4 and subtract time 1 to see what the change was generally in each of the groups. You can see that in some instances, we have the blue dashed line that's higher than the yellow dashed line, and the higher blue dashed line means that there is a greater improvement in the intervention group than there is in the control group. Because all of this data was group-based, it was based in the clinics that they were coming from and not individual-based, we can only look at these trends generally like this. So we're looking at the net change overall for the groups. You can see that at 7 and 9 months is where we really see differences. And then it starts to draw off where it's pretty much even across the board for all of the other age categories. Next. So then finally, we just want to look at what the resulting conclusions were. While the group data did allow us to look at the observation of general trends across the intervention and control sites, it limited our ability to directly link the immunization status to specific individuals who received text message reminders. So again, it was based on what immunization rates were at each of the groups and the clinics that were assigned. So we really couldn't dive into whether individuals were actually participating and reading through the information that was sent to them, or if they had questions about the information that was sent. So really, individual level data would allow for precise tracking of caregiver visits and immunizations and could reveal more meaningful and statistically significant differences between groups. So for future, we do hope that there are efforts that should push for more individual level data collection for stronger results, just so that we can actually look at more of the things that lead parents to immunize or not their children. And I'll pass it back to Allison to close this off.
Thank you, Kat. So in conclusion, when comparing immunization rates at WIC sites where all families received the immunization text intervention to the WIC sites where immunization texts were not provided, the text message reminders were associated with a greater % change in immunization status at some ages, particularly the 5 to 15 months, but did not lead to a significant increase in up-to-date immunization rates at the intervention sites. Second, follow-up phone interviews with caregivers revealed that the messages were perceived as helpful. Although the text did not necessarily change caregivers' decisions about whether to vaccinate, they were seen as useful reminders that helped families schedule timely appointments and follow through with their child's doctor visits to receive recommended vaccines. And given the existing workload and time constraints faced by WIC staff, adding a staff-led counseling on immunizations during WIC appointments would have created an unsustainable burden. Therefore, a text-only intervention was considered a reasonable and realistic approach within the context of a program that provides nutrition and breastfeeding services. And I didn't add this here, but given on the reliance on text messaging, it is recommended that If we did continue future messages, we include direct references to immunizations within the text itself, particularly for participants who may not click through to view the linked web page. And additionally, the content that was developed for the web pages serves as a valuable resource and could be utilized by WIC staff during routine counseling appointments when following up on immunization status in alignment with the standard protocol. So that concludes our presentation. Thanks so much for your time. And we appreciate your attention. Thank you.
I want to thank both of our speakers today for terrific content and a very interesting intervention that was very interesting to see your results. Also to get such a terrific overview on WIC. If you've been waiting to ask questions, now is the time. We also received some questions during the registration process, and we will try to get to as many questions as possible, but we may combine questions of a similar nature. And if you have not already done so, please type your question into the question section at the bottom of your screen. If you have any technical difficulties, please use the chat section and we will work to assist you. I would also like to remind you that following this program, an evaluation will automatically pop up on your screen. We really appreciate your responses. The California Immunization Coalition produces 3 to 4 education hours per year, along with emerging issues conversations, and we rely on your feedback for improving the content of our program and also for identifying topics and speakers for future programs. So let's go ahead and get started with our first questions. We have a couple that are general to the WIC program and a couple that are specific to your intervention. First, I just want to comment on the quality of your text messages. They were really excellent with all the links, and the click-through rates were very encouraging. Also, I want to just comment that your opt-out rate was very low, which is also a very good sign. So one of our questions is, will the text campaign continue after this pilot program, and will there be messaging on COVID vaccines? And I guess I'll toss that one to Allison.
Yes. So at the moment, we aren't continuing the text messaging campaign. This was it ended in June. It really would be really up to CDPH WIC to decide what's next, if this is something that will continue or try it out in other agencies. That I can't speak on behalf of that, but it really depends on what CDPH would like to do next. CDPH WIC would like to do next with it. And in terms of I did answer the text response, and we don't have any plans for encouraging the COVID-19 vaccination at the moment. Hopefully that answers your question.
It does. Thank you so much. And a question for Kat. The phone interviews appeared to be very positive. I was just curious, was your selection of folks to include in your phone interview, was that random, or were those folks that demonstrated an interest in, like, say, clicking through? Were those more engaged participants that you chose to do your phone interview with, or was that completely random?
That was completely random in the sense that, it depended on their response. So we had a mix of those who were up to date, those who did go to their doctor visit but didn't get all, and then those that haven't gone yet. Those who didn't respond back to that follow-up survey, they were excluded from us randomly selecting. So it was really for those who responded based on those 3 responses. But otherwise, it was random and whoever picked up. But we did get a mix of all 3 groups.
And then Kat, a question for you. Again, I mentioned there was a really low opt-out rate. I'm not a numbers person, but clearly you are. Was that a low opt-out rate in general with how these text campaigns go?
I can't really speak to in general. It does seem pretty low. Our agency does track all of those numbers, but Allison works closely with our PQC team to track all the texting so she can get more information about that.
Okay. And again, if you do have a question, please go ahead and type it into the Q&A section on at the bottom of your screen. A couple of general questions. I know, Allison, you mentioned WIC eligibility, and I'm sure there are lots of specifics on WIC eligibility. I know there's a lot of terrific benefits for families. Does Medi-Cal eligibility, is that if you are Medi-Cal eligible, are you then necessarily WIC eligible?
Um, yes. So if you, when we screen for income, when looking at eligibility for the WIC program, typically if a participant who is enrolling has Medi-Cal, CalFresh, CalWorks, that can make them automatically eligible, or what we call adjunctively eligible. So yes, there is a way for us to see if they are adjunctively eligible, which would make them eligible to receive WIC services.
And then as far as WIC eligibility referrals, you outlined the referral process really clearly. That was so helpful. In general, would you say are most WIC participants, do they self-refer or are they mostly referred by providers?
Um, a lot of it is word of mouth, like in their community, family, friends, relatives we hear, but we do have, an outreach department who goes out to various, healthcare provider locations, schools. So we do have an outreach department that helps with trying to recruit more. And we also have a public website, and also, participants are able to search pretty easily online to see what services that can help them with, food benefits or things like that. So specific searches can help, and they're able to pop up and find WIC usually.
Right. Well, your webpage looks beautiful and very user-friendly, so I just have to definitely commend you on that. So this is a little bit of a painful question to ask. In our current climate, with so much of our social safety net being threatened, do you anticipate or have you experienced any cuts to the funding for the WIC program, which I think I understand correctly, it's a federal program. Have you experienced any cuts, and do you anticipate any cuts to your program?
That I can't speak to, just because I don't know that much information about that. So this time I can't answer or respond to that. So sorry.
That's okay. It's a hard one for, I think, everybody who works in federal programs. I think everyone's having a hard time answering that. So thanks for giving it a shot. So that kind of brings us to the end of our questions. Do you, Allison or Kat, do you have any final thoughts that you'd like to share with our participants?
Thanks again for having us. This project, I will tell you that I'm not an immunization pro. What I guess I'm good at is, I know the WIC program, and I work with our wonderful departments within my agency to make this intervention project happen. It was really a pleasure to work with Rebecca Boyd and the CDPH immunization team. But it really helped figure out, what it is that we can do for the WIC program, and how we can promote immunization screening within our WIC population. And so it was really fun. It was a really fun project to work on, and hopefully we could do something with it in the future. So thank you, everybody.
And Kat, do you have any final thoughts or comments?
just want to thank everybody for their attention. I do know that it's a little bit more complicated when it gets into immunization rates and all that. We did have a couple questions about up-to-date rates. And that was all calculated outside of our agency. So we only received aggregate data. We would like to look at individual data, but for this project, we weren't allowed to look at anything that was outside of the scope of aggregate data. So just putting in a plug for anybody that wants to advocate for us to get data matching in there so that we can get more access to individual level data for families. This way we can really help providers and pediatricians get in contact with their families who really need to get their children immunized. So thank you all for having us.
Well, thank you both again, and I really do appreciate both the overview on WIC and the specifics about your intervention. And I'd also like to thank Cameron Lawton, our program manager, and she's our technical guru behind the scenes, and Catherine Martin, who is CIC's executive director, and also like to thank the members of the CIC Education Committee for their support in planning and coordinating this call. And also I'd like to thank Rebecca Boyd from CDPH because she really got us headed in the right direction to pull this together. And thanks to all of you for spending your hour with us. Please remember to complete the evaluation form that will automatically pop up after this broadcast concludes and tell us what you think of the webinar. We really do appreciate your responses. Links to this webinar, as well as past webinars, are available at the California Immunization Coalition website, as well as our YouTube channel. Our next CIC webinar will be announced via email in our monthly newsletter. And thank you again for joining us today, and I hope you enjoy the rest of your afternoon. Thank you all.